Health Minute, I'm Holly Furfur.
Well, most of us know someone who's had a stroke, but we may not realize how serious the problem is in this country. Channel 8's Charles Ely talked with a national expert on identifying and preventing strokes.
It's predicted to be 650,000 people will suffer stroke in the United States this year, and more timely is that tomorrow is World Stroke Day. So it's very important that we do something about this, and not only the number of strokes a year, but it's predicted to increase to 2030 a significant number of strokes in our population. So identifying the warning signs of stroke is the least we can do to prevent people that are very near to us to have a stroke and call for help. It's very crucial at this point.
How do I know that I'm at risk for a stroke? Are there some specific things in my health or lifestyle that make me prone to a stroke?
No doubt that the obvious things are usually if you have high blood pressure, diabetes, smoking. These are classic known risk factors, but a lot of times stroke can be silent, or they can the risk factors can be quite silent, and so the identifying also a warning sign that a stroke is happening is a crucial part of this message for us in this day, and it's just this call for knowledge of how to identify warning signs.
Now, what are those warning signs? If I'm sitting next to somebody and they're having a stroke, how would I know?
I think that the Together to End Stroke initiative by the American Stroke Association and Covidien, which is a global healthcare product company, that is teaching us the acronym FAST, and recognizing face, arm, and speech changes and calling for 911 help is very important. So the FAST, the F, stands for face changes or weakness or numbness or facial droop, arm weakness, or having problems with the ability to speak or comprehend the speech, as well as that will bring you to time, which is you have call 911 as soon as you recognize any of one of these findings.
Now, if I want to prevent a stroke in my own life, what kind of steps do I need to take to build some insurance in?
Yearly checkups, and be aware of your health in terms of your blood pressure, your sugar levels, your cholesterol. These are very basic things that we should be doing. But I think that even so, it's very key that you are well aware that if any changes like the ones I described to you happen, you've got to recognize that a stroke is happening and call for help at that moment.
Some good advice. It's important to remember that strokes can be subtle, so be conscious of the symptoms. And for more life-saving information, we have a link on this story at KTUL.com. All right, we got to talk to Andrew about our weather. I know a lot of people are worried about this rain, Andrew.